So this is Dr. Asam Goel, MD Medicine, DM from top medical schools in Delhi and also MD USA and DM USA. So this is a video on migraine. I will be honest with you, migraine is the most common kind of headache which makes the majority of the headache seen in the neurology practice. We probably heard about migraine or know about migraine, and migraine is what involves a episodic moderate to severe throbbing pain or headache, usually on the one side of the head. We may have a nausea, vomiting. We may be very sensitive to sound or smell. So these are called triggers in migraine. Anybody who has episodes of migraine usually can recognize the triggers. And other triggers can be hormonal changes in women, or lack of sleep, or certain fruits can actually precipitate migraine. Even some strong smells can precipitate migraine. To be honest, migraine pain can last for hours and days, and pain can be so bad that it can interfere your daily life. And it can become very difficult to function. Also use a term in migraine like aura. Aura is like, you have some kind of like visual symptoms, flashing of light. You see some blind spot in front of your eyes, and feel a sense of tingling on your face, side of the face or in the arm. You may feel like, food cravings. You can feel your neck is becoming stiff. You are yawning. And so what are the auras? They actually vary from person to person. I did mention that, migraine can usually occur on one side of the head, but it can occur on both sides of the head. There is no question whenever you are having migraine headache and you already doesn't know the management, you should consult a physician. Migraine usually has a genetic basis. It is a very common disorder. It affects almost 15%, 15% of the population. Well, another thing, probably we physicians know that it's more common in women's than in men. I talk about the aura. Almost 75% of the patients with the migraine may not have aura. Like I said, migraine runs in the family, and most common age for migraine headaches is between 30 and 40 years of age. To be very honest, there are two most common causes of disability, which cause disability in us the first number one is the back pain, and then migraine is the second one, most common cause for making us disabled, or we are not able to function in day-to-day life. So whenever you see a physician, usually physician or neurologist can diagnose your migraine based on the clinical symptoms, based on your symptoms, your examination. There is no specific diagnostic criteria or no specific diagnostic test for migraine. And if you're as far as treatment goes, if you're having a mild attack, you can use aspirin or acetaminophen or Tylenol. And ibuprofen is also effective. And then if migraine is severe, there's prescription medicines, what we call triptans, what we call alkaloids like ergotamine and dihydroergotamine. So these are the triptans are the first choice of prescription medication, and we can take them as pills, or we can take them as a oral spray. We can even as an injection. And dihydrotamine also comes as a nasal spray. We squirt in the nose, and it is very effective if taken early in the treatment, like early in the migraine. Some nausea and feel like throwing up, obviously you take medicines for nausea and vomiting. So this is pretty much what you need to know in day-to-day life about migraine. Uh, Hopefully, if you migraine, you manage it well, and like I said, you stay in constant touch with the physician. I mean, follow them regularly, and and you can find out what is very more effective for you. You will find out what is more effective for you. Thank you so much.